National Population Policy. So India was the first country in the world to launch National Family Planning Program in 1952. And the aim of this program was to reduce the birth rates, stabilizing the population growth. So over the decades, the program evolved in response to demographic pressures, socio-economic changes, and global health commitments. So in 1976 April, India formulated its first national population policy. So this policy made the legal minimum age of marriage from 15 to 18 years for females and from 18 to 21 for males. This policy became largely irrelevant due to the implementation of challenges, and it was then modified in 1977 again. Then the government emphasized the importance of the small family norm without any compulsion. And then the program was renamed as Family Welfare Program. In 1983, when a national health policy came, it set long term demographic goals. So, to achieve a net reproduction rate NRR of 1 by year 2000, but the target was not met. So, in by year 2000, India's population had crossed 1 billion, accounting for 16% of the world's population, while occupying only 2.4% of global land area. So, this demographic pressure necessitated a comprehensive and integrated approach, leading to the adoption of National Population Policy 2000. Now, what is National Population Policy? It reaffirmed the government's commitment to target-free approach in administering family planning services, ensuring that the individuals had the right to make informed and voluntary choices regarding reproductive health. So, unlike earlier policies, NPP 2000 was not limited to fertility and mortality rates, but it addressed broader issues. What broader issues were addressed? Women's education and empowerment for improved health and nutrition, child survival and health, meeting unmet needs for family welfare services, meeting healthcare for underserved groups such as urban slums, tribal communities, hill populations, and migrant groups. Then adolescent health and education, increased participation of men in planned parenthood, and collaboration with NGOs. So the objective was that the total fertility rate of 2.1 should be met by 2010. We have to stabilize population by 2045 with sustainable economic growth, social development, and environmental protection. Ensure universal access to all reproductive and child health services. We have to reduce infant, child, and maternal mortality rates. We have to promote delayed marriages and responsible parenthood and empower women through education, healthcare, and nutrition. So, the socio-demographic goals for 2010 were to address unmet needs for reproductive and child health services, make school education free and compulsory up to age of 14, reduce the dropouts below 20%, reduce IMR to 30, reduce MMR to 100, achieve universal immunization for all the children, promote delayed marriages, preferably after 20 years of age, achieve 80% institutional deliveries, ensure universal access to information and counseling for all fertility and fertility regulation and contraception, achieve 100% registration of all births, deaths, marriages, and pregnancies, contain the spread of HIV and AIDS and integrate management of RTIs and STIs, and integrate Indian system of medicine and promote the social sector programs to make family welfare a people-centered initiative. So the outcomes, what were the outcomes now? Now NPP 2000 anticipated that India's population in 2010 would be 1107 million compared to 1162 million projected by the technical group of population projections. However, by 2011, it was 1210 million, overshooting the target by 110 million. Now, this gap has to be highlighted, and This gap highlighted the challenges in implementation and the unmet needs of national population policy. Now, what were the implementation strategies thereafter? That we have to strengthen the care infrastructure at village blocks level, expand the contraception services, promote women empowerment, involve NGOs and private sector also in service delivery. We have to promote IEC campaigns, then decentralize the implementation through panchayats and nagar palikas. Then what happened in 2003? What were the achievements of this NPP 2010? So the achievement that was made, that total fertility rate was 2 in 2023, close to the replacement level. IMR reduced to 27, MMR declined to 97, immunization coverage expanded, polio eradication was achieved, and there was increased awareness of family planning methods. But still, the population was not at all analyzed, that how much is the population. So by the achievements that we achieved by 2023, the challenges that we had. Number one, regional disparities still persist in the states of Bihar, UP, and Madhya Pradesh. Early marriages and adolescent pregnancies are very common in certain areas. Gender inequality and son preference is continued. Health expenditure is low. It is 1.2 to 1.5 of a percent of GDP. Unmet needs for contraception remains significant, and gaps in coverage and outreach, particularly in rural and underserved populations, is still there. So this is all about our national population policy.